Hey everyone, I'm Surgeon Brandon, and I'm here to talk to you all about the difference between non-operative and operative management for a medical problem. If you all enjoyed this video, please like, subscribe, follow. It helps me do more of these and gives me more encouragement. So let's jump right in. Whenever a patient presents to their healthcare provider with a problem, we usually conceptualize this problem through a medical diagnosis. And a diagnosis is associated with that problem. And with that problem, we then develop a treatment plan that usually involves at least two different buckets, and I think it's easiest to conceptualize it that way. One would be non-operative management, and the other would be operative management. Particularly for surgeons, this is a good way to characterize it because it separates the two. And so when you think about operative management, I think that can be pretty familiar with a lot of people. Someone that has a total knee replacement, someone that has carpal tunnel surgery, someone that has a shoulder replacement, someone that had their gallbladder removed, someone that has cardiovascular surgery or abdominal surgery or hernia repair, sports-related ACL reconstruction. Those all fall under operative management. And you can imagine these type of management plans involves a patient going to the operating room, having a procedure that's done in the operating room, hence the name operative management. Fairly straightforward, and there's many problems that require operative management because non-operative management, the outcomes may be so poor that the patient would do worse if they did not have surgery. However, it's really critical to emphasize that almost any diagnosis, non-operative management should by and large be the first treatment modality that's at least considered. Let's go into what some of those may be. So non-operative management can mean everything from medication management, prescribing a specific therapy, whether it's working with a physical therapist, working with an occupational therapist, or a hands therapist, whether it's having a knee corticosteroid injection for arthritis, to even working with a chiropractor. Various treatment modalities that don't require specific operative intervention. And there are a host of non-operative management and really some great options. And honestly, the possibilities with non-operative management is really remarkable. And I can't emphasize that enough. And I can't cover all the options with non-operative management, but I think it's really important and critical to understand that when a patient has a problem, that non-operative management should really be the first thing considered. There are a lot of cases where even after we consider non-operative management, for example, in the case of an open fracture where the bone is exposed from the skin, in that situation, non-operative management is not effective in achieving the rates of decreased infection as going to the OR, washing out that wound, providing the appropriate fixation as one might expect. All right, thank you all.